Uterine tube or fallopian tube or salpinx. Uterine tubes are a pair of ducts which transmit the ova from the ovary to the uterine cavity. Location. It lies in the upper free margin of the broad ligament of the uterus. This is the uterus. So the broad ligament is present here. Near the upper free margin, the uterine tube is present. External features. It is about 10 cm long. It has two ends, medial end, lateral end. The medial end opens into the lateral angle of the uterus, and the uterine ostium, that is the lumen of the medial end, is about 1 millimeter in diameter. Lateral end. The lateral end of the fimbriated end is curved and presents or possesses finger-like projections known as fimbriae. The abdominal ostium, that is the lumen of the lateral end, is about 3 millimeter in diameter. Parts. The fallopian tube consists of intramural part, isthmus, ampulla, and infundibulum. Intramural part or interstitial part. It lies within the uterus, between the fundus and body. That is at the junction of fundus and the body, the intramural part or the interstitial part is present. It is about 1 centimeter long. Isthmus. It is narrow, rounded, and cord-like and lies lateral to the uterus. It is about 3 centimeter long. Ampulla. It is the largest and widest part of the uterine tube. It is a common site of fertilization. So the fertilization takes place in the ampulla of the uterine tube. It is about 5 centimeter long. Infundibulum. As the name refers, it is funnel shaped and the circumference of the infundibulum presents or possesses finger-like projections known as fimbriae. It is about 1 centimeter long. Blood supply. Medial 2/3 of the uterine tube is supplied by the uterine artery and the lateral 1/3 by the ovarian arteries. Venous drainage. The uterine vein and the ovarian vein drains the venous blood from the uterine tube. Nerve supply. It has both sympathetic and parasympathetic. Sympathetic is derived from T11 to L2 segments of spinal cord. Parasympathetic is by vagus nerve and pelvic splanchnic nerves. Lymphatic drainage. The lymphatics from the uterine tube drains into internal iliac lymph nodes, pre and para-aortic lymph nodes. Clinical anatomy. Salpingitis. Inflammation of uterine tube or the salpinx is known as salpingitis. Tubectomy. It is a procedure in which each uterine tube is cut or resected. It is the most common family planning method in female. In this procedure, the uterine tube is ligated at 2 points and the segment of the tube between the ligature is resected. It is done in both the tubes. Ectopic pregnancy. The uterine tube is one of the common site of ectopic pregnancy and it is always associated with intraperitoneal hemorrhage. Thank you.